Hello, I'm Dr. Pierre Samaan. It's great being back with you as we continue this series on addiction and unmasking addiction. This series that we're presently on as part of Unmasking Addiction is The Brain on Drugs, Part 4. Last time we were speaking of uppers and stimulants. This time we're going to get into the downers, those things that kind of bring you down. But they're those drugs that act as, you might say, sedatives. You know, they are numbing. They block the substance P, neurotransmitting chemical that causes pain, and among other things that they do, giving you a euphoria and whatever else, which leads to a problem with addiction because it's seducing. You don't realize it's bringing you to that point of losing control over what you're taking. Sedatives, also called downers, are used both for medicinal properties of pain relief, cough suppression, diarrhea control, and for psychological properties of sedation and euphoria. The leading cause of preventable deaths in the United States is prescription drug abuse. Now, I don't have to tell you that. We all know that. We see it on the news every day. More of these things are occurring. And we're knowing family members and friends. It's no longer that person down the block that have been negatively impacted by drug abuse. Almost half of those 40,000 deaths are due to downers in the classification of tranquilizers such as opioids, painkillers, for example, the opiates, among other things. Unlike stimulants, which are uppers that we spoke of in our last video, which stimulate the central nervous system, depressants, well, they're downers. They depress the central nervous system. It slows that function in some way. And in some cases, there's an initial stimulation. We'll talk about that in a moment. But that depressant effect that occurs results in relaxation. So there's a feel-good that goes on there, euphoria. There's a intoxicating euphoria that comes from it. Pain relief. You take your aspirins and whatever else for pain relief. Well, these are stronger, and so you don't realize that they are drawing you deeper and deeper into a hole that's going to be harder and harder to get out of. So another symptom, well, they sedate you. They bring about confusion. It's not easy to think when you're on a downer. When you're on a depressant, you're slower. You're having more difficulty putting thoughts together. One reason for that, and perhaps the biggest reason for that is, remember we've spoken about the upper room of the brain, that's the top half of your brain, the bottom half being the basement, what we call the basement of your brain. That basement area is where depressants or downers bring you down into that basement area. And that creates confusion, difficulty thinking through problem solving, because it's putting to sleep the frontal lobe area and the upper part, the upper area where good thinking is located. So your problem solving, your detailed thinking, your putting two and two together, really it's up there at the top part of the brain. And that's normal up there, and you want it to stay normal. But when it drops down into the basement, you go down those steps into the basement because you're taking a downer, well, that's where you're going to reside. Yeah, it's going to relax you, it's going to give you a sense of euphoric intoxication, but it's also going to dumb you down. Same in a similar way as stimulants, they're going to dumb you down, but they're going to do it in a different way. So confusion comes about, drowsiness, dizziness, nausea, vomiting, urinary retention, pupillary constriction, respiratory depression, and if used in excess, a coma, without even realizing it. All of a sudden, you're gone. While stimulants release and amplify the body's natural stimulatory neurotransmitting chemicals, the sedatives induce euphoric intoxication or high that often suppresses the impulses and emotions. And so when you see someone down, you can tell, you just kind of, okay, and now maybe they're depressed and there are other reasons for it, but certainly if they're on downers, they're going to be that way. There's different temperaments that will take different drugs. For example, the National Christian Counselors Association that I'm licensed through, they speak of 4 basic temperaments: melancholy, sanguine, phlegmatic, supine, and in those temperaments, if someone's a sanguine, they're an extrovert. What do extroverts want to take as a drug? They usually want to take something to calm them down, don't they? And so they frequently will use downers. Choleric temperament may want to use downers because they get so intense and they need to come down. The melancholy or loner temperament and supine temperament, the melancholy may want to be stimulated because they tend to be down very easily and they need a little uplift, so they seek after stimulation. Unfortunately, they turn to alcohol, which may stimulate initially, but then that has a downing effect and it makes them worse. Supines can be either or. Phlegmatics, they're reality-based. That's indifference is a good word when you think of phlegmatic temperament. They're middle. They're very democratic. They like reality. They don't like using drugs. They don't like drinking in excess. They want to stay on that ground, both feet on the ground. And so you don't see them having addiction problems. I mean, it happens, but now we can have combinations of temperaments in your social, your inclusion, that'd be just in general, social, interacting with others, people who are superficial to you, or workplace and so on. You may have a temperament there that might be a melancholy temperament, a loner temperament. But then in control, you might have, that's decision-making responsibility area, you might have a, let's say, a choleric temperament, strong-willed, let's get it done, goal-oriented. And then in affection, there might be melancholy again, or there might be a sanguine temperament, and they want closeness, and they want everybody, they want a revolving door in their home, a lot of people. Very different in those two areas, sometimes confusing, but what about drug use, drug abuse? What happens when they have that combination? So a lot of times when there's problems at work or in general, the melancholy is going to turn to something to stimulate them, something to bring them up, to get them to feel like they can keep up with everybody else emotionally, or get along with the others in the office or whatever it might be. But in affection, they're trying so hard and all that they may need to come down. So then they use something different. So those differences can make a difference on what drug of choice may occur. The only way to really find out is take a survey. I don't like those paper surveys. They only give you a general look. They don't give you the combination of your 3 main need areas of inclusion, control, and affection. So you really need a digital survey, and the National Christian Counselors Association has the Arno Profile System survey that we do, and that identifies and breaks down your temperament types in those areas. I've seen those charts with those paper ones, and frankly, they they put combinations of temperaments all together in one temperament. It doesn't make sense when you read the charts. But this one gives you more detail. It's actually closer to the personality test. If you were to do a personality test with someone, you get a closer look at the foundation of where that personality is coming from. So what drugs of choice do they use? A lot of it depends on their temperaments. At the same time, depressants exert their effects through various biochemical processes. So it's not necessarily just temperament or personality. What's going on the inside? What's your DNA? What's your chemistry? In different brain regions, the spinal cord and other organs such as the heart are affected by the drug abuse. And when I talk about things like, let's say, alcohol, well, okay, you can have a beer. It's not going to kill you to have a beer. The Medical Association at one point was saying 2 drinks a day is fine. Now I don't know if they're still saying that because in addiction we recognize that even 1 drink is a toxin to your body. It damages, it affects your body, and if you continue doing it, there's a cascading effect over a period of time. There are 4 categories of sedatives or tranquilizers, or what we call downers, that are also central nervous system depressants. And in those 4 categories, you have the opiates or opioids, and we hear about that a lot on the news. That's opium, heroin, oxycodone, hydrocodone, bupropion, methadone. A lot of methadone people being treated for opiate use with the treatment of methadone, which I don't agree with. Initially, I agree with it. Methadone, when it first came out as a treatment, was for 90 days. And so you'd go to a methadone center or methadone clinic, you'd have to get the prescription for it, and you would go and get your methadone dose for that day or that period of time that it's given to you. And then after about a couple of weeks, a month, they start reducing it. They're supposed to start reducing it so that at the 90-day period, you've gone through your withdrawals, it's over with, and you're off the methadone. That's what it was designed for. That's what it was really, that was the purpose of methadone treatment. And years ago, I began having more and more clients dealing with methadone addiction, going to the methadone clinics, and they were keeping them on for years. I asked one fellow, I said, well, you're only supposed to be on this 90 days. How long have you been on it? 5 years. What? 5 years? How do they get away with that? Back then, we were required to contact the authorities that this clinic was not doing their job, that they were giving it far longer than they were supposed to give it. Nowadays, no, they really don't do that anymore. Yeah, it should be limited, because if it's not limited, what are you going to do? Well, it's still giving you a bit of a high. It's still euphoric. It's still helping you to buzz out, you might say, but it still keeps you addicted. Your tissues remain addicted. You remain tissue dependent. It's not helping in the long run. It's just going to make things worse. And of course, fentanyl is that terrible one that comes out of another country that basically is trying to kill all of us, I guess, in this country. And that's a synthetic form of opium. Then there's sedative hypnotics is another category of downers. And sedative hypnotics are like benzodiazepines, including alprazolam, which brand name is Xanax, clonazepam, brand name is Klonopin, barbiturates, and others, even Ambien, which is a brand name for a sleeping medication. Now, in and of itself, those are not bad, but you can abuse them. And if you go above and beyond taking what you're supposed to take, now that's not good. That can create tissue dependence. That can create more problems and an addictive, a lack of self-control over time that now you have to have it. You can't live without it. But when you take it as prescribed, especially if, let's say, anxiety, and it's part of the makeup of your mind and body, and whenever I say mind and body, whenever I say body, basically that means your mind as well. So it's a makeup of your body. You may need a sedative to calm you down, to get you through those panic attacks or anxiety attacks, but not too much. Just as prescribed. Alcohol is another category of downers, your beer, your wine, your spirits. And then there's others. In that other category is antihistamines, skeletal muscle relaxants, and over-the-counter tranquilizers, such as sleeping pills that you get over the counter. That's in that other category. Small doses of sedatives depress the central nervous system, which slows the heart and the breathing rate. It relaxes the muscles. It impairs coordination, induces sleep, dulls the senses, relieves pain, and controls diarrhea. Those things are some things. We need those little help sometimes with that, especially if you had diarrhea in the middle of the night. Oh my gosh, you need a little help, and you go get that imipramine to help you with the diarrhea. But you know what? You can abuse that, and I've had clients that have abused it, and they have to take it every night, every night, every night. Opiates and opioids can cause nausea, constriction of pupils. Pupils get real narrow, and also constipation. So you can usually tell, when I used to work in a psychiatric unit many years ago, I remember the nurses had called me in to help them, and they had an addict who had come in, and he was addicted to heroin, and he was just so constipated, he couldn't go to the bathroom. And they had to take a spoon and work at trying to help clear that passage to get him to be able to relieve himself. And that was an ordeal, all because of the heroin use. The downer excess constipates, and when that happens, it can be very uncomfortable. And certainly another reason to only take it as prescribed. Excessive consumption, and not talking about heroin as prescribed, but opioid or pain-relieving medications. Excessive consumption of alcohol and tranquilizers or sleeping pills or opioids impair that physical coordination. That's why they stagger. That's why they go from one side of the room or the other. Slurred speech, digestive problems. So it's not only constipation, sometimes the opposite occurs with diarrhea as well, as I've spoken of. But guess what? They also cause sexual dysfunction. And you hear about that a lot. Oh, take this pill, take that pill for your sexual dysfunction. And yet they're using these sedatives, these opioids, these downers, and it's impairing their sexual relationships with their spouses. And it creates tissue dependence, resulting in physical withdrawal of agony. That's what's so upsetting to the addict that can keep them on the drug, because they're so afraid of the withdrawals. It's so painful, excruciating, flu-like symptoms. They're more afraid of that than the addiction, so they continue in that addiction. High doses or in combination with other sedatives can result in dangerous respiratory depression, overdose, and even coma, as I mentioned before. Initially, Small doses, especially alcohol, small doses act as stimulants. So in downers, you can have some that will act as a stimulant like alcohol initially. As they reduce the stiffness, which can lead to loose and sometimes irresponsible behavior. So once the little bit of stimulation is done with, once they're done with the six-pack, hour later, crash, down they go. And before you know it, I need more. Yeah, I got to go get another six-pack. And during that stimulant period, they're not thinking right. And especially if they're driving. And that's why you shouldn't drink and drive. When taking more of the drug, the general depressive effects predominate, relaxing and numbing the mind, reducing anxiety, and controlling some neurosis. Neurosis is symptoms of stress. It's a pressure of emotional things wanting to come up, memories and whatever else, and those conscious things wanting to push them back down, and some of those conscious things wanting to push those other things back down may be substitutes. So someone may become obsessive or may eat too much or stop eating in order to keep down whatever is wanting to come up. So depression, anxiety, obsessive behavior, hypochondria can come out of neurosis, but not a radical loss of touch with reality. Some sedatives can also induce euphoria or a sense of well-being. Long-term use of tranquilizers or downers can lead to psychological and physical dependence and addiction. Certainly that's obvious. Because of their potentially lower overdose potential, the benzodiazepines, as I mentioned earlier, dominated the prescription tranquilizer market for some time. Prescription drug abuse had spread to all sections of society. When do you think that happened? How far back do you think that was? The year 2000. So in the year 2000, prescription drug abuse spread throughout society. It became, you might say, a true epidemic at that point. Cross-tolerance is when a person develops an ability to tolerate one drug and other drugs of the same classification, such as alcohol or opioid. There'll still be an opioid greater effect to it, but you'll need to take more. If you've been drinking too much over a period of time, you'll tolerate the opioid more. Heroin addict will endure morphine or methadone even if the addict has never taken them before. So there's cross-toleration. The exact biological mechanisms that produce tolerance to one opioid also makes tolerance to others. As I've said, tissue dependence is a little something different. Tissue dependence occurs due to the body's biological adaptation to long-term use of a drug. Now that can be as simple as medication, for example, just normal medication. You have some people that are medication sensitive, some people they build tolerance to their medication quickly, and so their doctor has to increase it frequently or change it frequently. That's tissue dependence or tissue tolerance that occurs. The body compensates by restoring the balance, the homeostatic levels, they call it, and altering homeostatic components or the balance, those components of the body that keep the balance, this chemistry, this organ, that organ, to withstand chemical stressors. So that balance needs to stay in balance. When you take a drug, whether it be an opiate or alcohol, it's putting you out of whack. It's changing your system it's making it out of balance. Now, balance is also your circadian rhythm in your body. The reset creates processes by which the body responds to chemical stressors to compensate for biological stability during prolonged drug exposure. Changes can be extensive, especially with the use of sedatives. The tissue addiction returns faster with each relapse of the offender. Let me say that again. When someone is addicted and they stop for 6 months, a year, even 5 years or longer, the tissue dependence can still be there. And they start again, one time, and it's as if they never stopped. Now, it doesn't happen with everyone, but many of them, that's what happens. And that's why one person can do that and get away with it, and the others say, hey, he got away with it, why don't I'll give it a try too, and they didn't get away with it. So relapse is going to be faster if you've been addicted in this area of downers. I don't know about you, but why do something that you know is dangerous for you? Why take the risk just to get along with your friends when you go to a party, just to not be seen different? If you have an alcohol problem, well, get a Coke, or an iced tea to hold in your hand. So it appears as though you have something with you and you don't seem so different because you're not drinking anything. Instead of, oh, well, I'll drink along with them because I don't want them to think I'm not part of them, or I don't want to be rejected by them. That takes self-control. And if you don't already have that self-control walking into that little party, you might have problems. So build up that self-control before participating with those people that you know might be doing things that you really don't want to do. Since alcohol has been the most popular sedative or downer for many years, the next video we're going to do, it's still a downer, so we're going to focus on alcohol. And in focusing on alcohol, we're going to take a peek at the possibility that the years of gene mutation with alcohol may be contributing to the addictive personality. And we've had that series on the addictive personality. Well, we're going to talk a little bit about where does that really come from inside of us? Why do some people have it and some don't? And alcohol may be a factor to it, even if you've never drank before. We'll see what we have to say about that next time. The Bible tells us, therefore, surrender yourselves under God's almighty healing, under his healing hand, that he might restore you, uplifting you to his ideal in due time. Pour out all your worries. That's the basement, remember? The fear and apprehension center of the brain, limbic system center, the fight or flight or freeze center. Fear and apprehension is down there. Your worries are down there. How do you come up out of there? How do you go up the steps and get up into the upper room? Well, you restore yourself by uplifting yourself to that upper room, pouring out all your worries, frustrations, burdens upon him, upon the Lord. You might have to start with pouring it out to a friend or to a professional or to someone else, and work your way up to pouring it out to the Lord. Because when you do, it gives you hope. Stay calm and keep a clear head. The Bible goes on to tell us, and this is a paraphrased Bible, don't allow your emotions to take charge, which is what drugs do. They cause your emotions to take charge because they drop you into the basement of your brain, where the emotion center of your brain is located. You don't have self-control down there. You have impulses, and those impulses are feel-good impulses escaping impulses or fighting impulses. You're not up top where you can think through things, have self-control, and problem solve in a more ideal way. Because Satan, your enemy, is stalking around, roaring like a lion, seeking to consume you with fear, down the basement, fear and doubt, but resist him and don't be afraid. Resist is get out of the basement, don't drop down into there, don't open that stairway down into your basement, stay up top. Keep your trust in God strong, because you know that your fellow believers throughout the world are also being attacked in the same way. For God did not give you a character of insecurity, doubt, and fear, but a mind and character of confidence, power in the truth, love, and self-control. I hope this was helpful for you today. May your troubles be more minor, blessings more, and happiness come through your door. We'll see you next time.